Welcome back once again. My name is Sochuko Jamarai from Outreach Project for Healthier Communities. Our goal is to improve the health of communities. And today we'll be talking about one overlooked factor that might affect your health. It's called finance. Now you're probably thinking, aren't you supposed to be working on health? And isn't health based on medicine and what you do in the hospital? Well, your health is a little bit more intricate than that. It's more complicated. So there's multiple parts that affect your health and your overall outcome of health. One of that is finance. Simply put, how much money do you have? Now it's no surprise that if you do have more money, you have better access to care. If you have more money, you can afford that care, that procedure, whatever it may be, that is pretty pricey. Versus if you don't have money, you might not be able to. For instance, let's say you live in a developing country and you get malaria. Now, this is a condition that is pretty treatable. It's not lethal. If you live in the US, you get malaria, it's going to get treated and you'll come out fine. But if you live in a developing country where there's lower income, or let's say you're just in a lower income environment, your health outcomes could be reduced simply because of this factor. You don't have access to that medication, for instance, or if there is medication that's available or care available, you probably just don't have the income or the resources to acquire that. So that's why we'll be talking about finance and how finance can impact your health. We'll talk about managing your money. This is something that, unfortunately, in lower income neighborhoods and just communities, it's not very well understood or misunderstood for whatever reason. So we'll break it down, make it simple, and we'll discuss ways we can manage your finances. So the first part of our discussion is mentality. Now we talked about why finance is important concerning your health. Well, unfortunately, finance is, for whatever reason, it's misunderstood in some of these communities. So we need to just simplify it and get the right mentality when it comes to finance. Mentality wise, money is important. It does have a big impact on your healthcare and what you can get access to. But if you mismanage your money, it can be hard and difficult for you to get that appropriate care when it is needed. So, we'll talk about ways you can do that. For the first part, we need to make sure we have a way of just managing and storing our money. And typically, this is done through a bank account. If you don't have a bank account, go online and look for ways that you can open up a bank account. Now, I'll put a link. I bank with Chase, and Chase has an offer for giving you $500 if you just up to $500 if you open up a new account with them. Now this might vary. I've seen it as low as 350 and all the way up to 600. Point being, if you open up a checking account with them, you're able to then get a reward, a benefit. Now different bank accounts do offer this, so you can explore that. I'm just telling you the one that I use. So what you want to do is open up an account. A checking account is what you use for your daily expenses to make different payments. Savings account is what's put on the side for you to save money and just accumulate wealth. So this is the first step. Just have some form of account where you can put all your money in and manage that. Well, after you've taken that first step, you want to make sure you know why you're saving that money. Well, that money is meant for different uses. One, to pay your bills. That's very important, and that's just what you need to do for your daily expenses and just to live. So, go ahead and make that payment. But what do you do with that extra money? Well, with that extra money, you put it off to the side and you can make a separate account. You can call it a different savings account just within that bank. And with that savings account, what you can do is then put in more money. Let's say you put in $10 each month. You don't necessarily need it in this moment, but it's a just in case account. So when health problems do arise, you have this account to make those payments and get that care that you need, whether it's a medication or it's a procedure that's been prescribed to you. You have access to that. Doing this simple move it can have such a dramatic impact. Once again, I go back to the story about malaria. If you get malaria in a developing country where there's low income and people are generally poor, it's pretty much a death sentence, unfortunately. Most people die. There's a high level of death associated with this, and it's quite preventable. If you just have the right income or resources, it could simply improve your health outcome. So do this first step. Go ahead and open up a bank account and put your money in there, and open up a separate account for savings and just put some money in there each month, whatever you can afford. This is just in case money, in case you do get sick, you have access to that to make payments for your health care. Thank you for watching this video. I hope it provided some useful information for you. Go ahead and check out the rest of our videos and see ways you can improve your health outcome.